Hey guys, Tony Maritato here. I'm going to read a question that came in the Facebook group, Medicare billing for mostly cash-based PTOTSLP. So I think it's really important that we understand how Medicare Advantage plans work, and this is a great question to highlight some confusion on the topic. So this particular person said, I'm really confused. I'd like some insight. I'm a contracted Medicare Part B provider. I saw a client who says she has Medicare. So there's Medicare Part B, there's Medicare Part A, and Medicare Part C. There's more Medicare plans than that, but Medicare Part C is Medicare Advantage. So when a patient says I have Medicare, they're not exactly wrong. They do. It's just a Medicare Advantage plan, maybe not Medicare Part B. So back to this, patient says she has Medicare, Medicare Advantage with United Healthcare, and Medicaid. So the first red flag right there is the individual patient cannot have both concurrent Medicare Part B and Medicare Part C, which is the Medicare Advantage. You can have one or the other, you cannot have both. Now, yes, they can have Medicaid as a secondary to either Medicare Part B or Medicare Advantage, but you can't have Medicare Advantage and Medicare Part B concurrently. One has to be inactive. Most of the time, when somebody has a Medicare Advantage plan, the Medicare Part B is inactive. Medicare doesn't come and take away the red, white, and blue card. They might still have Medicare Part A coverage, but most of the time, Medicare Part B is not active. So going on, she says, she's not sure which is the primary, which is a secondary or tertiary. Well, I'll tell you right now, she does not have a tertiary. She has either Medicare Part B and Medicaid or Medicare Advantage and Medicaid. She says Medicare doesn't pay for anything. That's because it's not active. Most of the medical goes through United, which is further evidence that she does not have Medicare Part B. She only has Medicare Advantage through United. And the rest goes through Medicaid. She says that Medicaid pays for both premiums. I logged into NGS, which is this particular therapist's MAC for Medicare, and I can see that Medicare B eligibility due to disability. So she could be Medicare Part B eligible. That doesn't mean she has active Medicare Part B. On the left side of the NGS site, there's a tab for Medicare Advantage, and when I click on it, it shows that she has a United Healthcare. That's definitive confirmation that she does not have Medicare Part B. Only Medicare Advantage through United and Medicaid as the secondary. Underneath the Advantage tab, there's a tab for crossover. When I click on it, it shows that she has Medicaid. So my question is, does she have Medicare Part B or Advantage? Definitively, she has Advantage. She does not have Medicare Part B. Do I submit the claim to Medicare? No, you do not, because when it's a Medicare Advantage plan, you submit the claim to the plan manager, to United or Humana or Aetna or MedMutual. The Advantage plan does have out-of-network coverage. Should I just call NGS to verify this? So, I mean, you can call if you want, but I can tell you based on the information you provided definitively, this person does not have Medicare Part B. They have Medicare Advantage through United with Medicaid as the secondary. Typically, when Medicaid is the secondary, you're not able to collect from the patient. So this could be a recipe for disaster, truthfully. If the patient, is, I don't know where to tell you to go with this. You're going to call United Healthcare. They're going to quote you benefits potentially for out-of-network coverage. Because you are a participating Medicare Part B provider, you're limited to only collect what United Healthcare Medicare Advantage will allow. But being that there's a Medicaid plan in the secondary position, you're going to be limited by that. My hunch is you're probably not going to get paid, and even if you do, there's going to be so much administrative cost, you're not going to be able to treat this individual profitably. So this would be a scenario where your best bet is to refer this individual out to another provider, preferably somebody who is contracted with United, who is contracted with Medicaid in your state, and just thank whomever for the referral. but this is probably not something you want to get involved with if you don't have the time, the resources, the administrative team to really handle something like this. But thank you so much for asking the question. And anybody else who's looking for this kind of information, number one, check out my course, Zero to Paid Medicare Billing. That's where we go through not just billing Medicare Part B, but we also cover billing Medicare Advantage as out-of-network and non-Medicare plans as an out-of-network provider. Also, you can check out our free Facebook group, Medicare Billing for Mostly Cash-Based PTOT SLP. Either way, I wish you guys the best. Share your questions, and I'll catch you on the next video.